Hi, I'm Muzammil. Thank you for tuning in. This video is looking at medication, let's say specifically depression medication, and are scientific studies the only way, the only resource that doctors use to make decisions on medication for depression? So my background is valid, it's relevant here in that I'm trained as a doctor, I've worked in psychiatry in clinic, and I've worked in psychiatry over more than 10 years. And so I've worked with patients presenting with depression. Now, while my journey has moved on, I've worked for a number of years, one-to-one and groups with non-pharmaceutical approaches. So I've trained as an emotional breakthrough journey therapist and use other approaches as well, but essentially not using medication. So I've been, let's say, in different spaces and in different paradigms of how the world is. In exploring this question about scientific research and depression medication, let me just present two different polarized groups of people. One group are the hardcore scientists, let's say. So let's say they believe that if it's not in the scientific literature, then you shouldn't be doing it. Everything has to be based on science. So that's one group of people. The other group are maybe those that reject the scientific literature, that, hang on, stuff that is in the scientific literature, let's say mainstream medicines, they've only been there for a few years, really, in the wider scheme of things. Whereas traditional medicines have been there for thousands of years, and we've got information over such a longer period of time for them. So they're two different groups, polarized, opposites in some ways. In order to explore this question in a kind of practical way, let's look at what happens on the ground. What is it really that informs doctors' decisions? Is it just the scientific literature? So let's take this scenario. A patient comes to a doctor, and just to keep this relatively short, let's say they are confirmed to have depression. Let's say there's a medication that the scientific literature has found to be very effective for depression. Doctor prescribed it, but for this patient, there's no improvement, despite checking for compliance, despite giving it enough time, despite going up with a dose. So there's been no improvement in the clinic. What should the doctor do? Any doctor at that point would look at a different intervention, switching the medication or a different intervention altogether. So what have they based that decision on? Because there's been no published research on that patient to say that it's ineffective for them. The doctor has concluded it's ineffective, that this very effective medicine is ineffective for that patient based on direct experience. And that's what's led them to change the medication. And conversely, if there was a medication that is found to be pretty ineffective for depression, but with a patient taking it, it lifted their mood on repeated occasions, let's say, just to clear that doubt. So the scientific literature says pretty ineffective, but in the clinic, the doctor's finding that for that patient, it's very effective, or they're finding it very effective for a lot of patients in that clinic. How does that then inform the doctor's decision? it would inform the doctor to continue to prescribe that medication for the patient who's benefiting from it. And so it's pretty clear that the doctors do and would draw on information that is outside of the scope of scientific research. It's outside of the scope of the scientific literature. That they are using direct experience in order to inform their decisions. And yes, they are also drawing on the scientific literature, but it's not either or, it's both. That both are actually valid. Both the scientific literature and direct experience are valid, even though in the direct experience scenario, there would be psychological and social factors that play a role. But that's part of the territory. And yet, despite that impurity, we still use that context to inform decisions about what intervention to continue or to stop. So I'm interested in your thoughts. What do you think? What is the value of science in healthcare, in medications and any other interventions, for depression or otherwise? I'd love to hear your thoughts, and you can slot them into the comments box. And if you want to follow me, I'd love it if you did that, or click like. And I look forward to seeing you on the next video. Thanks for watching.